Hello again, everybody. This is Dr. Rob Lindsay at Vallejo Health and Wellness Center, and in today's root cause of the day video, I want to talk to you about a little girl who came to me. Now, this is a little girl who was adopted and from another country, and when she was brought to America, to her forever home, her mom brought her in because she had had white tongue, chronic white tongue, and really bad breath. She also had some really troubling behavioral issues, and she had been to lots of doctors. And what we found with her, let me back up. She also had tummy aches. She also had cold sores, and she had diarrhea. So she was 6 years old at the time, and when we started to test her out, what I found was that she had, first of all, when I say test her out, what I mean is I was using functional toxicology testing, using what are little vials that are imprinted with the energetic frequencies of organ tissues and or the substances that we're trying to get out of the body. In this case, through our testing, I found that her small intestine was full of salmonella. But more than that, she had a chronic Candida infection. Now, Candida is a yeast that is a normal part of our microbiome. It is also in the fungal family, and there are lots of different species of Candida. The most common one is called Candida albicans, but there's Candida glabrata and Candida krusei, and these different Candidas, if they get out of balance compared to the other types of microbiome bacteria in our body, then they can flourish, and they can lead to a whole host of different types of symptoms, different things that you can see. For example, a white tongue, they call it thrush, and typically what they'll do is try to kill it with antifungals. But in this case, she had the chronic Candida that was on her tongue, but more importantly, it was within her digestive system, particularly in her small intestine. There are cells called Peyer's patches, and these cells in the small intestine were loaded with Candida. So you could do things to try to get the tongue to clear up, but if you don't work on the actual source, the gut, and in this case, more so, we had to find out, well, what was causing her to have a Candida overgrowth? Well, again, antibiotics. See, antibiotics don't discriminate in the kind of bacteria they kill. They kill even the good stuff. So now if you knock down a whole bunch of the good stuff that were keeping the Candida in balance, all of a sudden the Candida can flourish. They can rise up, and it's too many, and they can affect different parts of the body. So we were able to do some testing and then some treatment using some homeopathic remedies that are custom made, and boom, it knocks down the Candida, but more importantly, it helps to bring back that normal microbiome back into balance, so that she's not continually dealing with this issue over and over and over. Oh, and really important, by the way, we had to reduce or eliminate the antibiotic residues that were inside her body, which allowed the Candida to flourish in the first place. So really, if you don't go to the root cause, you're going to have a hard time getting well, and that's what we are all about here at Vallejo Health and Wellness Center. Get to the root. We'll talk to you again soon.